And we're back for another special Dane by Local member update. I'm really pleased to be joined by Bonnie of Public Health of Madison and Dane County. It's a very important time. There's a new order that came out on Wednesday, the 18th of November. There are very good reasons for that order. The situation here with COVID is pretty serious, just like it is around much of the country. And public health has been trying to help us this whole time. So Bonnie's going to explain this new order. We're going to talk through some of the do's and don'ts, what it means, what it doesn't mean, and just kind of clarify as much as we possibly can. Bonnie, thanks for taking time for us this morning.
Thank you, Jason, for having me.
You bet. So please tell us, first of all, what is order number 10 and what are the basics of that?
The basics of Order 10 are that we've changed the gatherings to no gatherings indoors, and outdoor gatherings went from 25 to 10 people. So there are no other changes in the order except around the gatherings. And the reason for that is our disease levels in our community are so high right now that no gathering is completely safe.
That's going to be a little different than what we've had, right? Because people to this point, we've talked about what gatherings could be and limiting size and keeping your general groupings very small for safety. But now the order is because of the situation we are, because of the trends we've been seeing, right? That's why this limit has been put in place.
Correct. And, there's a lot of data and trends that are driving this order change. And we look at our data to make these decisions for changing our orders for a better outcome. And with this high level disease in our community, gatherings are the main driver right now of our disease spread. 1/4 of the people who tested positive for COVID-19 here in Dane County are reporting that they had went to a gathering or a party just prior to testing positive. So if we can prevent all individuals in our community from gathering right now, we can have a significant impact on reducing the spread of COVID-19.
I want to go back to that in a second, but I'm showing the graphs right here, which just kind of talks about the impact it's having on our healthcare system. Experts have been telling us about how this could play out for our healthcare, for our healthcare system, for our healthcare people who work in healthcare. And we know a number of them have been dealing with this for months in a lower capacity, but now it's at such a capacity that it's really putting a strain on our hospitals and our facilities that are healthcare based.
Absolutely. Hospitals right now cannot keep up. And if you are to look at our data dashboard, we have some really good graphics that show right now how many people are hospitalized and how many of those individuals that are hospitalized that are in ICU. And we are at a very critical level and a level we have not been at the entire time of this emergency response. And if we don't take action now, we're not sure we can keep up. And so this new order, if we follow this order, we can make that significant impact and reduce that stress and burden that's on our hospitals right now, and prevent more people from getting COVID and people dying from COVID. This is a critical hour. If we don't do that, I don't know how we're going to be able to keep up in 2 to 4 weeks, which is 1 to 2 more incubation periods of COVID-19.
You can see it's very, very different right now, and it's very challenging. Before we go back to what this means for people right now, because I think people are going to have a strong reaction, some of them to this order and to what you just said. But for the people in public health and for all of our community, I just think people have to understand that our public health officials are just trying to help us get through this situation as safely as possible and as quickly as possible, right, Bonnie? Because if we can bring these numbers down and control this better, then we can come out on the other end more quickly.
Absolutely. Public health, when we make these decisions and order changes, we are really working hard to create a roadmap to a faster and more sustained recovery. We want our community and our economy back to normal as much as everybody else does in our community. And, we're all experiencing, the effects of job losses and school closures, social isolation, fears around health and safety. And, a lot of us are frightened and angry and frustrated. And we too at Public Health feel the same way. We want our economy and our schools to reopen. And at the same time, we want to protect our friends and our families and our neighbors from the virus. And we know that if we don't, there will be even worse consequences for our economy and for our schools. So we really believe that if all in our community follow these new orders, we can make that significant impact such that we can get back to a faster and more sustained recovery.
I think that's such a great way to say it. I mean, just so people understand, public health is not here. They're not trying to make your life more difficult. They're not doing these things because they want to. They're doing these things to try to help us all get through this quicker and safer. And I think that's such an important message to get out to people right now, because people are frustrated, Bonnie. They're fatigued. They're, like you said, we're all just kind of in this state of how much longer do we need to deal with this? Well, the virus dictates that. We don't dictate that, right?
That's right. And it is hard. It is such a difficult time, especially given the holidays and all of us wanting to see loved ones. But it's so important right now to stay the course. When you see that graph of where we're at in our hospital and the number of people in ICU, that's really driving the point home. As much as we want to celebrate right now with our loved ones, we need to be physically apart. And the best gift of all that we can give one another is by following this course of action so we can keep each other and our community healthy and safe.
Obviously, Bonnie, with the holidays, this is going to be challenging for people, like we said, with that message. A lot of people were maybe planning to gather small or gather with family on Thanksgiving. What we're saying is, and what public health is saying, is you should not be doing that right now. And because of that, I think it's going to be challenging for people to accept that. But the reasons are there. The graph we showed you, the information is there. This is not something that's to be taken lightly. Basically is kind of what I think everyone's trying to wrap their heads around at this point, if they haven't yet. So I just wanted to make sure that we reemphasize that. Other than family gatherings and personal gatherings right now, who else is affected?
It does affect some other businesses, especially businesses that rely upon events or meetings or classes or trainings or conferences. All those types of venues cannot be happening right now because they are a business model that is such that revolves around people gathering. So all of us in the community right now, we can't do any indoor games, sports, competitions, group exercise. We cannot do any meetings, trainings, movies, events, or conferences. All sports activities are considered gatherings and are prohibited inside right now amongst people you don't live with. And also other events outside of religious services or practices at our churches, like picnics or staff meetings, are not allowed inside either. Now, I do want to mention that we can still do these things outside up to 10 people, but when you do so, you are required to wear your face covering and to do physical distancing.
I know you also received some questions following the order too about services and things like that at a person's home. So tell us about that, please.
Yes, you can still go ahead with services. So if you have an appointment at the salon or a barber, if your children have piano lessons, if you need the plumber to come over to fix your sink, or if you have a nanny that comes over to do childcare, or your elderly parent has healthcare aid that's coming in their home, all these things are still allowed and they are not considered gatherings. And the reason why they're not considered gatherings is because when you're hiring a service to do that kind of work, they are working as a business and they already have in place the policies to prevent the spread of COVID-19 and are following those protective measures. And if it's just yourself or your household and yourself with the service person, not considered a gathering under this order. So all those things can still happen.
That's good. Now, we mentioned the holidays, and that brings us to holiday shopping too. Such a tradition for so many people, and such a big, important time for retailers too. What does that look like safely this year?
We can do holiday shopping, and the reason why that's different than gathering is because when we go shopping, we're not going shopping. We're not going to go shopping. I should stress that. You're not going to go shopping with anyone else but your family or household or living unit, people that you live with. So when you're going shopping, you're going to show up, do what you need to do, and leave. Very different than gathering, where people are coming all at once at one moment in time and sharing a space. So those two things are very different. The likelihood of having a close contact in a gathering setting is very high. The likelihood of having a close contact when you're doing your retail shopping is very low. But I would say that when people do those activities, if it can be done online and you can take advantage of the curbside and carry out services, do so. And if that's not possible, make sure that you plan your shopping trips so that um, you could be doing it in an efficient manner where you're showing up, you got your mask on, you're preventing distancing, and you're moving quickly through your shopping, so you're spending very little time in those spaces.
And I think just being respectful of each other, the virus, all of that during this time we're doing that is really important, and we can shop safely. The other really great thing as we bring it back to our local businesses is that so many of them have made these accommodations too for shoppers that, if you're not comfortable going in during regular hours or you want to set up a personal appointment, a number of businesses that have offered that. If you call them, you can set up a time to go in, just you and your family, and do your shopping right there. And that's incredible service from our local businesses.
And I also want to do a shout out for businesses because when we moved from the Safer at Home orders into the Public Health Madison Dane County emergency orders, we gave all businesses a week to implement policies to prevent the spread of COVID-19 amongst their employees and within our community. And businesses are doing a great job implementing policies around hygiene, around employee illness, cleaning procedures, and protective measures. That are above and beyond and really important to preventing the spread. So when we go into these business spaces, they are safe in the way that there is oversight on the best practices and ways to prevent the spread of COVID-19. So I just want to thank all those businesses that took a lot of extra time, money, and training of staff and providing a protective measures like masks and plexiglass barriers to create a safer environment for all in our community, and really appreciate the partnership that businesses have had with public health all along.
I just want to walk people through this real quickly to get clear information. So if they go to the Public Health Madison-Dane County website, right here, there's a banner at the top. You click that. There's important stuff for businesses right here too, like you just talked about. So if you're a business owner, you can follow these resources and it's clearly laid out, right?
Correct. And if you were to go down this page that you're on right now and click on requirements for businesses and activities, here you see that this is the page where all businesses should be taking a look at on a weekly basis, making sure they have the most current information. It shows right up here on the top that all businesses are required to have a sign posted at their entrance reminding everyone to wear a mask before entering. It also reminds businesses that they need to post somewhere within their business the workplace requirements for employers and workers. And this document really talks about the responsibility of employers to implement those policies to prevent the spread of COVID-19 amongst their staff, but it also expresses the importance of workers to have a commitment and a responsibility themselves to follow those policies in the workplace. So it's really important to have that both the employer and the employee to be committed to doing the right thing by those policies to keep everybody safe in the workplace. And as you scroll down, there's also a toolkit for businesses, and we have them numbered. All those numbers are important to be implemented at your business. You can see the first three are what I was talking about earlier: a hygiene policy, a cleaning policy, and a protective measure policy. And number 4 is that it is required that all businesses not only have those policies, but they've trained their staff and they can show public health that their staff has received that training. And that can be through either a log sheet or some kind of acknowledgement or even an email receipt. When we do our compliance checks, that's one of the things we're going to ask for from businesses. We're going to ask, do you have these policies in place? And can you show me that your staff has received this training? We really believe that by implementing these policies, we can make a significant difference in reducing the spread of COVID-19 in the workplace.
So Bonnie, with these trends and with seeing cases in a number of workplaces already, I know there's another tool that maybe not everybody is utilizing. And it's been a recommendation for quite some time.
Yes, we have in our order requirements that businesses should be promoting remote work to the extent possible. And what that means is if you have an employee that can be doing work from home, they should be working at home per our order requirements. Furthermore, I do know some employees that can work from home that just like going to the office. This is not a time to be making a decision to go to the office because you like it better. It is very clear in the orders that it is required for all that can be working remotely to be doing so. And it's so important at this time to be doing that. So please, 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 all of you, if you can be working remotely, continue to do so. And if you are an employer, please take the time to re-examine how your employees are working in the workplace. And if there's any opportunities for doing remote work, staggering shifts, spreading employees out to have more distancing, please do that now. This is a really critical hour where we need to re-examine what we're doing and do a better job together.
And what about work meetings and meetings in the workplace, Bonnie?
Right now, workplaces should not be having any meetings. Meetings fall under gathering, and there's no indoor gatherings at this time. Now, if a workplace can bring their meetings outside, they can have a meeting up to 10 people. However, no indoor meetings, no indoor conferences, no indoor trainings at this time. So businesses are going to have to consider ways that they can get information to their employees without meeting in person.
And Bonnie, we hear about the orders, we hear about the changes, and a lot of people are wondering again why. And they don't maybe they don't work in healthcare, maybe they're not directly impacted on a daily basis by some of these trends that are happening, but the trends are driving this decision.
Absolutely. Over the past 2 weeks, more than one person out of every 100 people in Dane County are testing positive for COVID-19. And for the sixth straight week, we have seen a 14-day average number of cases increase. And currently, it is at 436 cases per day. That's up 364 from the last snapshot. So this is a very critical hour. Our contact tracers can't keep up. We can no longer follow up with businesses to talk about employees that are testing positive. It's on to the businesses to do that contact tracing. Our hospitals can't keep up. Our ICUs can't keep up. We have more people in the hospital and more people dying from COVID in our community right now than ever during this emergency response. This is a critical time, and we need to take some serious action to prevent the spread of COVID-19 in our community.
Okay, Bonnie. So the other thing that I think we're seeing is that I know we're seeing is more and more businesses with an employee that tests positive, and to make sure that businesses know what to do in those situations. You have a great guide here, but we have to show people how to find that. So let's walk through and show everybody where to find that exactly.
Right. And I want to stress this is the most important document for businesses right now because it's very likely that businesses are going to have a positive employee, and we no longer have the capabilities to contact trace with workplaces. So it is up to the workplace to do that contact tracing when an employee tests positive at their workplace. So let's scroll down to in the toolkit to number 1, create and adopt a hygiene policy. And within that policy is your employee illness policy to prevent the spread of COVID-19. And we have a companion document called Employee is exposed to someone with COVID-19 or tested positive.
Right here
So
at the bottom of number 1. I just want to make sure everybody sees
Yep,
that.
that's it. That's the most important thing right now for
Okay.
businesses to have access to. Again, don't print it out. We want you to always go to the link so you have the most current information. But if you look through this document, it talks about what is a close contact? What do I do when I have an employee who tested positive? How do I clean my those spaces that the employee worked in? And do I need to close my facility or can I stay open? All these questions are answered here. And then at the end of the document, it gives a bunch of scenarios in a chart form that you might that might happen at your workplace. For instance, we get a lot of questions about an employee who has been a close contact of a close contact, and they're thinking they need to quarantine. But that is not true. In that scenario graph, it'll show you that if you're a close contact of a close contact, you can continue to work. However, if you're a close contact of a person who has tested positive, you must quarantine for the full 14 days, and no testing gets you out of the full 14-day quarantine. And for all businesses except for healthcare, all employees that are deemed a close contact must quarantine the full 14 days. And so here's that scenario chart I was referring to. And pretty much any scenario that an employee may have and be coming to you with, you'll be able to navigate through what you have to do to be compliant with the orders and for preventing the spread of COVID-19 amongst your staff.
What great, to lay it out this way, to have the scenarios, to have that all in place, and then tell people clearly how to deal with that situation or what's allowed. That's perfect. I think that's a common misconception, is that people think, oh, well, if I had, one of these close contact situations, I go get a test, it's negative, I can go back to work. I think some people think that's the case, but that is not the case, because that test is just a snapshot in time, right?
That's correct. When we go to get tested, we're only being tested that day, and it's only telling us whether that day we have COVID-19. And everyone needs to understand that upon being exposed to somebody who has tested positive for COVID-19, the incubation period is anywhere from 2 to 14 days after that exposure. So if you test 2 days after you were exposed, you may still get a negative test, but that does not mean that you're not going to get it, because the incubation period goes all the way through to 14 days. So we get a lot of questions from people saying, well, I was exposed to somebody who tested positive and deemed a close contact. When should I get tested if I don't have symptoms? And the recommendation from Public Health Madison Dane County is 3 to 5 days after being in contact with a positive person, you should get tested. If it comes back negative, you still need to follow through with your full quarantine. And if you're never symptomatic, we ask that you test again on day 14 just to determine whether or not you were an asymptomatic positive COVID case. So that's how that works. However, if you are a close contact and you go and get tested, early on and you're negative, but anytime throughout that quarantine you become symptomatic, at that time that you become symptomatic, we want you to come back and get tested right then and there. Don't wait. And that's really important for our whole community to hear right now. If you have any symptoms right now, any cold-like symptoms, assume it's COVID and get tested, please. We are seeing so many people who just have symptoms of what seems like a common cold or allergies, and they're not getting tested, and they're spreading COVID in our community. So if all of us do the right thing as soon as we don't feel well and get tested, we can also help to prevent the spread of COVID-19 in our community.
That's really what it's all about, right? It's going to take all of us working together. Public health is trying to guide us there and give us the tools to do it, but it's really up to us.
Mhm. We do have our testing sites open the day after Thanksgiving this year, as well as on Saturday. I'm going to be working one of those test sites. So it's pretty much all hands on deck here at Public Health. Most of us are working well over 8-hour days every day, and weekends and evenings, but we're doing this because we care so much about our community. And we know that it's the right thing to do for our community right now, and helping and assisting in this emergency response. And we really hope our community takes advantage of these resources that we have, so we all can be working together for the best outcome here.
Bonnie, thanks so much for walking us through so much of this today and telling us and giving us the updates and the why behind some of it. I think that's so important too, that people understand the why, because a lot of people see orders come down, or they, catch a headline or something, and they don't really understand everything behind it. But, I think that's really critical for people to understand that this is really just, in the end, what public health is trying to do at this moment, and has been all along, is trying to help us get through this safer and quicker, so we can recover faster, so we can get back to having more of a normal life and having a better economy and having people, be safe and stay healthy. And I know that's a number one goal for you too.
It is the number one goal, and we really believe that these orders, and by following these orders, we are creating that roadmap to a quicker and faster recovery. And we'll continue to look at our data and our trends in our community and adjust accordingly. And if we see that the trend is going in a positive direction, we can also recorrect with orders to allow us to have more normalcy in our life. But that is not where we're at today. So the big takeaway today is that we gotta be not gathering outside of our household or living unit. We need to be wearing masks when we go out. We need to maintain 6 feet or further from everyone right now when we're going out in public. And if we are any one of those individuals who are part of that vulnerable population, really you are safer at home right now.
Thanks, Bonnie, so much. Respect each other, respect the virus, and take care of everybody. So that's what we're all about. We're a community, everybody. We are. So Bonnie, thanks for your time. Thanks for all of this. Really appreciate it. And thanks for all your great work, and everyone in public health. We appreciate what you do.
Thank you, Jason. Be safe and be well.